I'm Ed Rowland, the principal and founder of Rowland Global LLC, and also one of the North American network partners for Nicholas Hall and Company. And I help companies go and or grow their global businesses basically from the North American continent.
I'm Steve Sowerby. I'm the founder of Exponential and the co-founder of the Consumer Healthcare Training Academy with Nicholas Hall. And I spend my time traveling around the world helping companies to grow their individuals and grow their brands and deliver growth to the industry.
And we're delighted to be teaming up here in North America for the launch of the Consumer Healthcare Training Institute of North America. Reflecting on our institute launch and the key points and what we've been focusing on, why don't you start, Steve?
Well, it's clear. As an industry, we are growing too slowly. The world has changed around us. Consumers are changing their habits. Healthcare authorities are moving the cost down to the consumer. We need to change, and therefore the Healthcare Training Institute will provide some of the ways that we can change by giving people the competencies, the behaviors, the attitudes, the skills to actually engage and grow the industry faster.
And it's a lovely combination of leveraging the wonderful track record and content already produced over the last 2 years and presented in Asia Pacific and in Europe. And in addition, what we'd like to bring to the US audience are lessons of what can you learn from the rest of the world. So how do we feel our offerings can benefit the North American audience?
I would like to say that we can certainly bring the learnings, as Ed has mentioned before, in terms of the rest of the world. So there's differences in terms of the interaction with pharmacy. There are differences in terms of the way that consumers are engaging with mobile technologies. There are a number of learnings which we can certainly bring for that. But in general, I would say to bring a change of mindset, because we need to change the way that we have been doing things in the past, because the world has changed around us. We need to start seeing the world through the eyes of the consumer, through looking at the category, not just about products. So hopefully we can inspire the industry here to start to see the world through some different eyes.
The other part of it, and what started the wonderful collaboration between Steve and Nicholas Hall, is there really is a wonderful framework and methodology to deliver this content that is lasting, sticky, and companies will come away with employees and colleagues that can actually affect change.
And that's really because we try to focus on not just giving people knowledge, but helping them to understand, because that is what will actually interact and create change. If people really understand what it means to them, then they will start to believe in it, and if they believe in it, then they will act. And that's what we're trying to do, not just to teach, but to inspire people to be able to change.
What's next up for the Institute? Well, we are collaborating on our launch, which is an open session, not one for one specific company, in September, September 24th, 25th, not too far from here, where we will run a 2-day seminar. The first day will focus on much of the content Steve and the Academy outside the US have already created, adapted to a US audience. And the second day will focus on lessons learned from the rest of the world.
Exactly. So what we will be doing is on the first day really looking at winning in the pharmacy, how we interact with the pharmacist, the pharmacy assistant, the drugstore staff, how we can really engage and inspire consumers and shoppers in that environment. And on the second day, as Ed mentioned, we're going to be really taking the best of insights from outside of the of North America and inspiring the audience in terms of how they can innovate within this market.
And we'll look at a couple of the near-in markets, in particular Canada and Mexico, and we will also look at some what-if scenarios. In the United States, for example, pharmacists cannot prescribe. However, in most of the world they can. And what does that mean if and when that would come to the United States, but at least understand that different framework. The key message through the Training Institute and the programs we're offering is there is another wonderful program out there that can help you grow, improve your people's knowledge base, and inspire them to act within the industry to achieve that elusive growth.
Yeah. And indeed, just to build on that, it alludes directly to that key message that people are your most important resource in driving growth, in building stronger brands, and therefore building a stronger industry. So if we're able to lead, inspire, develop our teams, that will deliver to us much more sustainable growth than just to invest in the communication strategy, for example.
The key takeaway points from the overall conference is if you're not comfortable with change, you're not going to be comfortable in our industry, and I would say probably in most every industry at this point. Certainly the digital world and the path of the patient/consumer has changed, and the omni-channel world that we live in is a reality, and that we need to be very quick and nimble in how we interact with how the world has changed.
Yeah. No, indeed. I think there was that message came through very, very clearly. And for me, it's that we have to act as an industry. An individual company, an individual brand will not do it. So we have to get engaged in more industry-wide initiatives in order to exact change. And certainly in this great market in North America, we can make a real difference as an industry to the health and health outcomes of our communities. And ultimately, that's why we're here. We're here to help communities and individuals to effectively engage in better health, longer lives, and happier lives, of course.
The overall conference, it's absolutely a wonderful opportunity to, in some cases, reconnect, make new connections, network with movers and shakers within the consumer healthcare and consumer wellness space, whether they be from the manufacturers, the service industry, digital. The whole gamut is here, and it's really one you can't miss, frankly.
And indeed, I think this conference brings together the industry. So we're already on that journey because Nicholas has been able to garner the engagement across companies, across agencies, across partners within the industry. So we really are able to be a community. And ultimately, coming out of the conference, we have to ask ourselves, okay, so what? So what does this mean for us as individual organizations, as individuals, in individual teams, individual brands? How can we play a piece of the puzzle in changing the dynamics of this industry in order that we can deliver better healthcare to our communities?